Welcome to the Aced It podcast, where we turn science into sense. This is season 10, and in this season, we will provide 10 knowledge-packed episodes with the hopes of helping listeners understand what we can all learn from current research on overdose. It's a hard topic to discuss, but critically important information to know. So I am honored that you're with us. I'm Danielle Rudes, your host, and this is Aced It. Welcome to today's episode, where we explore innovative strategies in harm reduction aimed at curbing fatal opioid overdoses. Harm reduction strategies play a crucial role in mitigating the adverse effects of substance use and promoting safer practices within communities. Side note, Season 9 of the Aced It podcast has 10 episodes explicitly focusing on harm reduction. Rather than focusing solely on abstinence, harm reduction approaches aim to minimize the negative consequences associated with drug use while respecting the autonomy and dignity of individuals. We'll begin by discussing an article written by Hawk and colleagues in 2015, focusing specifically on their discussion of harm reduction strategies. The landscape of public health approaches has shifted dramatically in recent years, moving away from punitive measures toward harm reduction initiatives. At the heart of harm reduction is the acknowledgement that drug use exists, and harm reduction aims to mitigate its adverse effects like HIV, hepatitis C, and fatal overdoses. Central to these efforts are targeted education on overdose prevention, widespread distribution of naloxone, and policies encouraging bystander intervention during overdoses. Certain populations face significantly elevated risks, including those with high-dose opioid prescriptions, individuals recently released from incarceration, and those combining opioids with alcohol or benzodiazepines. Hawk and colleagues discuss the role of emergency departments, having emerged as critical intervention points, offering unique opportunities for overdose education and naloxone distribution, especially to high-risk patients. A notable example of effective intervention is the Opioid Education and Naloxone Distribution Programs, OEND, implemented in emergency departments. This initiative demonstrated feasibility and acceptance among high-risk populations, highlighting its potential to save lives in critical moments. Interestingly, Hawk and colleagues also draw attention to carceral settings. Prisons play a pivotal role with alarmingly high rates of overdose deaths reported shortly after release. Efforts to provide overdose education and naloxone to individuals who are incarcerated pre-release show promise, but require further evaluation to gauge their impact. Naloxone distribution programs have gained significant traction, empowering community members to intervene swiftly in opioid overdoses. Originating from grassroots efforts, these programs have expanded nationwide, underscoring the importance of timely access to naloxone in saving lives. As we've discussed in prior episodes, the expansion of naloxone access hasn't been without challenges. Issues like fluctuating cost and logistical barriers have posed obstacles, prompting calls for alternative distribution models and closer monitoring by federal agencies like the FDA and ONDCP. Federal agencies play a crucial role in supporting these initiatives through resources like SAMHSA's Opioid Overdose Toolkit and the CDC's epidemiological data, which inform evidence-based strategies for communities nationwide. Despite these advancements, barriers remain within the medical community regarding naloxone prescription practices. Addressing physician reluctance through targeted education and alternative prescribing models is essential to further expand naloxone access. State-level policies, including Good Samaritan and naloxone laws, are pivotal in encouraging bystander assistance during overdoses. These laws provide legal protections vital for overcoming fears of legal repercussions among those witnessing overdoses. Reflecting on state implementations, Washington's 911 Good Samaritan law serves as a case study. Despite initial awareness challenges, subsequent educational efforts significantly increased its effectiveness among high-risk opioid users and law enforcement. Hawk and colleagues conclude their article by looking ahead, calling for continued research and evaluating the impact of these initiatives and refining strategies for maximum effectiveness. The evolving landscape underscores a growing consensus on harm reduction as a cornerstone of public health policy. And of course, other researchers have more recently responded to this call. In a 2022 article published by Mullaney and colleagues in The Lancet, the authors conduct a scoping review of articles aimed to explore the range of harm reduction interventions specifically tailored to equity-deserving populations, including racialized groups, Indigenous people, LGBTQIA2S+ individuals, people with disabilities, and women. The review searched through 10 databases up to July 2021, focusing on studies from New Zealand, Australia, Canada, and the US that assessed, implemented, or evaluated harm reduction strategies for opioid use within these populations. From over 12,000 citations screened, 15 studies met the criteria, with opioid agonist treatment, OAT, emerging as the most common intervention, particularly among women, including pregnant and postpartum peoples. Other interventions included overdose prevention, drug testing equipment, and outreach programs, with peer support and education for safer use. The findings underscored a significant gap in the research for populations such as those with disabilities and LGBTQIA2S+ individuals, indicating a pressing need for more inclusive and targeted approaches. Despite the prominence of OAT programs, the review highlighted the limited scope of current harm reduction efforts in addressing the full spectrum of social experiences among opioid users. Moreover, it emphasized the historical roots of harm reduction as a grassroots movement, challenging biomedical paradigms of drug use, calling for greater recognition of these origins within academic and policy frameworks. Integrating these insights with our earlier discussion on naloxone distribution and Good Samaritan laws, it becomes evident that advancing harm reduction requires not only broadening access to interventions like naloxone, but also ensuring these efforts are inclusive and responsive to diverse community needs. As we navigate forward, bridging these gaps in research and practice is essential to effectively combating the opioid crisis and promoting equitable health outcomes for all. Finally, in a 2024 article by Ellis and colleagues, the authors explore the evaluation of harm reduction policies and initiatives aimed at addressing opioid use disorder. Often, these initiatives are not focused solely on achieving abstinence, but rather on reducing the negative consequences associated with opioid use. The authors note that evaluation of harm reduction efforts needs to consider outcomes beyond just opioid use reduction. Many individuals accessing these services are not seeking treatment. So alternative outcomes such as reductions in opioid use disorder symptoms or related consequences are crucial metrics. The authors highlight what some of these may be. 1. Substance co-use considerations. Given the high prevalence of co-use of substances among those with opioid use disorder, harm reduction strategies should also aim to reduce simultaneous substance use, which significantly increases risks like overdose and respiratory depression. 2. Safer opioid use practices. Harm reduction programs target safer opioid use practices such as naloxone availability, needle sterilization, and alternative drug administration routes. These practices contribute to reducing overdose events and improving safety in opioid use contexts. 3. Overdose as an endpoint. Fatal and non-fatal overdose events are critical endpoints in evaluating harm reduction initiatives. Studies on safe consumption sites and naloxone distribution have shown promising results in reducing overdose mortality, though challenges like imprecise death certificates and stigma associated with non-fatal overdose reporting remain. 4. Emergency medical services use as an indicator. Considering emergency medical services as a proxy for non-fatal overdose incidents could provide complementary insights into the effectiveness of harm reduction strategies. 5. Improvements in community functioning. Beyond substance use reduction, harm reduction initiatives aim to enhance community functioning. Financial stability, achieved through stable housing, employment, and reduced substance-related spending, serves as a critical metric. Programs like Housing First and decriminalization efforts play pivotal roles by potentially increasing employment and housing opportunities while minimizing interactions with the criminal legal system. 6. Psychological and physical health outcomes. Co-occurring disorders are prevalent among those with opioid use disorder, significantly impacting quality of life. Reductions in symptoms or remission from disorders like major depressive disorder and generalized anxiety are vital outcomes, even in the absence of substantial changes in substance use. Improvements in the positive effects and overall well-being are also crucial markers of psychological health. Physical health improvements focus on reducing infectious disease transmission through initiatives like needle exchange programs and tracking outcomes such as engagement in health screening, treatment adherence, and reductions in disease transmission rates. 7. Linkage and adherence to evidence-based opioid use disorder treatment. Many individuals accessing harm reduction services, such as safe consumption sites, may eventually seek treatment for opioid use disorder. The initiation of treatment following engagement with harm reduction services can be considered a successful outcome. Safe consumption sites often provide information on treatment initiation or are directly linked with treatment programs, underscoring the importance of tracking treatment-seeking behaviors among service users. 8. Impact on treatment adherence. Harm reduction studies also assess whether adherence to opioid use disorder treatment is influenced by these interventions. Maintaining or improving treatment adherence while implementing harm reduction measures is crucial. For instance, initiatives like Housing First, which provide stable housing alongside community treatment, have shown no negative impact on medication adherence in methadone treatment settings. This underscores that harm reduction strategies can enhance overall well-being without compromising treatment outcomes. In conclusion, harm reduction strategies prioritize reducing morbidity and mortality associated with opioid use disorder while improving social functioning and quality of life. Initiatives like naloxone distribution and safer opioid supply are immediate actions to reduce overdose deaths. Comprehensive evaluation of harm reduction initiatives includes endpoints such as fatal and non-fatal overdoses, alongside physical and mental health outcomes to assess their benefits for individuals using opioids. Linking individuals to long-term treatment remains pivotal, even if initial engagement does not prioritize complete abstinence. Ultimately, harm reduction strategies offer critical support by prolonging lives and enhancing health, social relationships, and community conditions, thereby facilitating eventual entry into treatment on individual terms. Thank you for listening to the ACE-IT podcast. We love hearing from you, so if you have comments, topics to suggest, or some science you'd like us to cover in a future season, please write me, Danielle Rudes, at Sam Houston State University. My email is drudes@shsu.edu. And as always, thank you to the Justice Community Opioid Innovation Network, or JCOIN's Coordination and Translation Center, funded by the National Institute on Drug Abuse, housed at George Mason University, where this podcast originated. Thank you to our fabulous scriptwriters, Dr. Chelsea Narvi from Sam Houston State University and SHSU master student Jalen Magana. And a huge and heartfelt thank you to Jason Luchin and the team at Slonky LLC for their wonderful production, as always. Tune in again soon for another episode of ACE-IT.